continuing my urology consult series. I'm a urologist who practices in the New York metropolitan area. The topic for today is called Nocturia, which is the medical term for nighttime urination. So, needing to awaken from sleep to urinate one or more times is the definition. This is a very prevalent and bothersome symptom for many people. It is perhaps the most difficult symptom to treat. It involves both men and women. It has a very negative impact on the quality of life of those who suffer with it. It is very sleep disruptive, and it can result in fatigue, falls in the middle of the night, traffic accidents as a result of fatigue, etc. There are many causes of nocturia, many of which are not urological. When somebody has nocturia, the first thought is usually you have a urinary problem, you have a prostate problem, get to a urologist. That is not always the case. It can be due to volume overload states such as excessive fluid intake, especially caffeine. It can be due to edema, which is the accumulation of fluid in the extremities, specifically the legs. During sleep, in the recumbent position with the legs up, gravity returns a lot of that fluid to the circulation, and a lot of urine is made at night. There is a pituitary hormone called vasopressin, also known as anti-diuretic hormone, and changes in its release can profoundly affect nighttime urination. Neurological issues, diabetes, Parkinson's disease, multiple sclerosis, stroke, spinal cord injury, etc. can cause urinary frequency daytime as well as night. Systemic diseases such as chronic kidney deficiency, once again diabetes mellitus or diabetes insipidus can be responsible. Anxiety can result in frequent voiding. Sleep disorders, insomnia, obstructive sleep apnea is a big one. Restless leg syndrome, pain from arthritis, etc. can result in getting up and needing to use the bathroom at night. As far as urological causes, there are many. Any form of bladder irritation, such as a urinary tract infection, a stone, a cancer of the bladder, inflammation of the bladder, such as interstitial cystitis or radiation cystitis, the presence of a stent in the urinary tract after kidney stone surgery, having an overactive bladder, a small capacity bladder, incomplete emptying, as might be seen with somebody with an enlarged prostate, scar tissue in the urethra, a female with a dropped bladder, or somebody who has neurological issues related to the bladder. If the bladder is not emptying, there's lots of residual urine, and it can result in frequent voiding day and night. Something putting pressure on the bladder can also be responsible, such as a large uterine fibroid. The million-dollar question is, when one gets up at night a lot to urinate, are they voiding because of a full bladder, which would be appropriate, or because they are awakened for another reason, such as a sleep disorder or environmental cues? Is it isolated nighttime frequency, or is the frequency global, occurring during the day as well? There's a phenomenon called nocturnal polyuria, which essentially is the excessive production of urine at night. And it is due to deficient production of that hormone, antidiuretic hormone, in the elderly. As well, excessive fluid and caffeine intake, heart failure, and edema can also be responsible for that problem. A few words on this hormone, which is fundamental to nocturia for many people. Vasopressin, also known as anti-diuretic hormone. It's a pituitary hormone. It regulates water retention. It is basically released when we are dehydrated in order to concentrate our urine and reduce our urine volume. And in high concentrations, it can raise our blood pressure. Essentially, it is secreted by the pituitary in response to a reduction in our plasma volume or an increase in the concentration of our plasma. It's inhibited by alcohol. That's why if you have a few beers, you're often running to the bathroom in addition to the fluid load. But decreased release of this hormone or decreased sensitivity in the kidney, which is the organ that responds to the hormone, can cause this situation with frequent urination at night. So how do we evaluate a patient who comes in and complains of frequent nighttime voiding? It's important to get a good medical history in terms of diabetes, high blood pressure, heart failure, edema, any neurological issues, sleep disorders, and their urological history, obviously. What medications are they on? Are they on a diuretic, like Lasix or hydrochlorothiazide? What are their drinking patterns? As far as physical examination, prostate examination on men, pelvic examination on women, determination of how much urine is left in the bladder after voiding. Post-void residual is fundamentally important. Urinalysis, perhaps the simplest, the cheapest, and the most telling tool in the evaluation of nocturia is the voiding diary. It is simply a record for 24 hours, including, obviously, sleep time of urination and quantity of urination. And the next 3 slides depict 3 different voiding diaries. This first voiding diary shows 14 voids in 24 hours, and they're all huge volumes. Bladder is full every single time. What's the problem there? They're appropriate voids. This person is drinking overzealously. It is nothing other than that. Many people drink a lot of fluid because they want to stay well hydrated. It's good for the skin, it's good for the kidneys, but some people overdo it. Our thirst is a very good indication of our hydration status and should be the key factor in helping us decide whether we need to drink or not. We do not need to drink excessively. A lot of people do. The next diary, very interesting. All the daytime voids are tiny volumes. The nighttime voids, totally appropriate. So this person is getting up a few times in the middle of the night, and totally appropriately so, full bladder. But during the day, very small volumes. And there can be a number of underlying reasons for that. The next diary shows more than 20 voids in 24 hours, and they're all tiny volumes. Those are in milliliters. The previous 2 were in ounces. So this person has some urological issue going. They're urinating 1, 2, 3 ounces at a time. So in terms of management, the management of nocturia has to be tailored precisely to the underlying cause. So if it's overzealous fluid consumption, less fluid intake, less caffeine, particularly after dinner, less salt. Sometimes we even prescribe a diuretic. If it's a systemic disease like diabetes or congestive heart failure, edema, it needs to be optimally managed by the internist. As far as the edema, elevating the legs, watching the salt in the diet, and using compression stockings can be helpful. It's also sometimes helpful to put your legs up during the day to get some of that fluid off during the day so that there's less of an issue in the nighttime. Sleep issues, sometimes medication, sometimes evaluation by a sleep lab. If it's obstructive sleep apnea, using continuous positive airway pressure machines can make a remarkable difference in the nighttime urination. If it's physiological nocturnal diuresis, sometimes we use synthetic vasopressin, that is synthetic ADH hormone. It's called DDAVP. It's used for children who are bedwetters, and when used judiciously, it can be of great help. If somebody has an overactive bladder, it's treated appropriately with fluid management, exercises, and medications. If it's prostate enlargement, it's treated with either medications or surgery. And if it's failure to empty, resulting in a large residual, then the specific cause is treated carefully. For more information, you can go to our website,